let's discuss a topic of enduring significance in our modern society, and that is the negative effects of COVID-19 lockdowns experienced during the height of the pandemic, which, as of now in 2025, was about 5 years ago. With ample data and analyses now available, we can assess the wide ranging collateral damage from these measures. To tackle such broad issues requires looking at the problem through multiple angles and through multiple disciplines to figure out just what went wrong and how we might prevent similar overreaches in the future. The negative effects of COVID 19 lockdowns are deeply concerning for many reasons. When societies impose blanket restrictions on movement, work, and gathering, it creates a problem where a narrow focus on disease prevention becomes outweighed by long term economic and social strains. With millions facing job loss, isolation, and disruption of services, the burden on mental health systems, economies, and community structures became overwhelming. Economically, this led to widespread stagnation. Labor shortages in industries like hospitality, retail, and manufacturing slowed recovery, stifled innovation, and reduced productivity. Without the ability to operate normally, many regions experienced business closures, increased poverty, and lasting debt burdens. Socially, the consequences were just as serious. Lockdowns intensified isolation and mental health struggles, while closures of gathering places like churches eroded natural support networks. Over time, this breakdown of community and interpersonal bonds threatened the very stability of society. Now, at its core, lockdowns were intended to reduce viral spread by limiting human interactions, much like how public health experts emphasize masks based on studies using mannequins that didn't even have arms and focused solely on respiratory transmission. These mannequin based experiments, which simulated droplet expulsion but ignored real world factors like arm movements, surface contact, and human behavior, failed to account for the full picture of how viruses spread. People aren't mannequins. People actually have arms. Similarly, public health officials with tunnel vision prioritize decreasing COVID 19 transmission, but overlook the cascading unintended consequences on mental health, economies, social fabrics, and education. The cost benefit analysis, when fixated only on infection numbers, ignores the broader harms, highlighting the dangers of authoritarian government overreach that curtailed individual freedoms without proportional benefits. With that in mind, let's explore some of the key factors contributing to the negative effects of COVID 19 lockdowns. First and foremost, lockdowns led to a sharp decline in mental health across populations. Studies showed widespread increases in anxiety, depression, and stress. In the US and Europe, surveys indicated higher levels of insomnia, distress, and suicidal ideation, particularly among women and youth. Lockdowns exacerbated isolation, creating a scenario where reduced social interactions worsened psychological symptoms, with long term effects persisting even today, including sustained trauma and sleep disturbances. Now, proponents of lockdowns might argue the virus itself, through fear of illness, contributed to these issues. But evidence shows that restriction severity amplified harms far beyond baseline pandemic stress, with voluntary measures in less restrictive regions yielding lower mental health declines. By contrast, when economic priorities were sidelined, the fallout was profound. Macro level analysis revealed that lockdowns triggered the largest global economic crisis in over a century, with GDP contractions correlating strongly with restriction severity. Small businesses bore the brunt, with surveys of thousands of US firms showing disproportionate closures and revenue drops, widening inequality as larger companies were better equipped to adapt to restrictions. Regions with stricter measures saw negative growth and ballooning deficits, leading to soaring debt that continues to strain economies today. Advocates for lockdowns claim they prevented even worse economic damage by curbing the virus. Yet studies indicate that supply chain disruptions and voluntary behavior changes drove much of the recession, with lockdowns adding unnecessary layers of harm without commensurate benefits. Moreover, social effects were devastating, with closures of churches and community spaces amplifying isolation. Research shows increased mental health issues due to restricted worship and restrictions on gatherings. This erosion of communal bonds led to heightened loneliness, particularly for the older population, and broader societal polarization. While some argue that these measures saved lives, reducing transmission in groups, the evidence for religious closure's specific efficacy is weak, and the long-term social fragmentation outweighed any marginal gains, as hybrid adaptations in less restricted areas maintain community without spikes. Added to this academic Added to this is the academic toll from school closures. Global studies estimate significant learning losses, with students making little progress during remote learning and disadvantaged groups suffering the most. Performance in math and reading remains down, with long-term economic risks from reduced attainment and widened gaps. Pro-lockdown views suggest closures protected vulnerable children and staff, but data from regions with open schools show minimal excess mortality among youth, while the persistent losses, equating to years of education, impose generational costs that voluntary precautions could have mitigated. The dissolution of normal routines also impacted physical health. Lockdowns reduced exercise and increased obesity, with studies showing declines in activity levels and weight gain, contributing to higher rates of complications from obesity. As rates of inactivity rose, so did related health issues, creating more strain on healthcare systems long term. Supporters might claim lockdowns prevented hospital overloads, but overburdening was more tied to virus surges than activity of the people, and that induced sedentary lifestyles have led to ongoing health crises. Another factor to consider is the fact that as restrictions confined people indoors, domestic violence surged. Data from the US shows an increase in incidents, with global helplines reporting spikes in domestic violence. This left lasting scars, exacerbating mental health struggles. While some argue the lockdowns reduced overall crime, the hidden rise in intimate partner violence reveals a flawed trade-off, as isolation intensified rather than alleviated domestic risks. Another major factor was the rise in substance abuse. Studies link lockdowns to increased alcohol and drug use, with overdose deaths spiking due to isolation and stress. Environmental changes like disrupted services compounded this, leading to excess deaths. Proponents downplay this by noting virus-related stress, but restrictions linked to isolation was the key amplifier, far exceeding baseline effects. Together, these factors created a landscape where delayed medical care became rampant. Cancer screenings dropped, resulting in later diagnoses and higher mortality, with estimates of billions in cost and years of life lost. Lockdown advocates assert this prevented COVID overloads in hospitals, yet the net excess deaths from untreated conditions potentially surpassed projected virus savings, underscoring poor prioritization. We also cannot overlook the government overreach that enabled these harms. It is arguable, even in Western nations, that they acted like authoritarian regimes, abusing emergency power, such as complete community lockdowns, bans on private gatherings, and indefinite mandates. And as a result, public trust eroded. For many, the restrictions fostered withdrawal and purposelessness. Though they defended as a necessary measure for public health, such overreach violated civil liberties without evidence of superior outcomes, as less intrusive strategies achieved similar control. One common argument downplaying these effects is that lockdowns reduced COVID-19 mortality, justifying the measures by saving lives and preventing hospital overloads. While valid in intent, meta-analyses show minimal impact on deaths compared to voluntary approaches, with harms outweighing benefits in holistic assessments. Even with lower virus spread in some contexts, populations now face shrinking economies and health declines regardless, as the virus itself, regardless of restrictions, drove most of the surges, and lockdowns amplified collateral damage without proportional gains. In everyday life, society doesn't grind to a halt by banning all vehicular traffic despite The tragic reality tens of thousands of auto related deaths each year occur worldwide because we inherently accept calculated risk trade off. The immense benefits of mobility, commerce, and personal freedom far outweigh the dangers mitigated through sensible measures like seatbelts, speed limits, and traffic laws, rather than outright prohibition of driving. This analogy starkly illustrates the flawed logic behind COVID 19 lockdowns, where governments impose sweeping restrictions on movement, work, and gathering in a misguided attempt to eliminate viral risk entirely, ignoring the devastating collateral costs to mental health, economies, and education, as well as social fabrics that eclipse the virus toll in many regions. Just as we don't sacrifice social function to achieve zero road fatalities, pursuing zero COVID cases through authoritarian government overreach proved counterproductive, amplifying harms while voluntary precautions and targeted protections could have balanced public health with essential liberties, reminding us that true safety lies in proportional responses, not blanket shutdowns. And before someone says, but you have to go through education and training to drive. Yeah, kind of like we were educated to wash our hands, eat and sleep well, exercise and get fresh air. Where was the emphasis on this 5 years ago? No, instead, government authorities decided to shut everything down. So, in conclusion, addressing the negative effects of COVID 19 lockdowns isn't about quick fixes. It's about a holistic revival of balance, rights, health, and oversight. By tackling these interconnected issues, societies can chart a course toward renewal, ensuring vibrant futures for generations to come. What do you think? Let's prioritize freedoms, not just fears. Thanks for watching. Hit the like, hit the subscribe, and share your thoughts below.